Let's talk about the quality of implant. What is it made up of? How it has advanced over a period of time. So Dr. Afschin,
Yes.
would you please give some light on the quality of implant?
Yes, I gladly do. So in old days, 80s, the implants, as we said before, were smooth, and the gel inside was almost liquid. And the purpose why the companies produced it like that was to give a maximum natural feel. And they made the shell of the implant extremely thin to make it even more natural. Obviously, the problem with that was that over time we had a higher rate of ruptures of the implant due to mechanical stress. And because of the liquid silicone, it could spread into the body. And this was something that obviously nobody wanted. So then the company and the doctor sat together and they developed what we call a cohesive gel. So all modern implants are filled with a cohesive silicone gel. It means the gel is cross-linked. So if I take a modern implant like this one and I would cut it open, the gel would not flow. It's like a gummy bear. It stays in shape, which is much safer for the patient, even if the implant ruptures in case of an accident. And the shell has become more sturdy. So it's almost impossible to destroy the shell. It's very, very durable. And this is the reason why modern implants can last in the body for decades. If there is no other problem, we don't force patients to come in and change the implants after each 8 or 10 years, which was the recommendation in the 80s because of the obviously less sturdy quality.
That's very important to understand the quality of the implant. Now, while we are at it, this is a very interesting, and I'm sure you've gone through the price, the tug of war between, the prices by different specialists or by different centers. Why there is so much of difference in the prices of this surgery?
Let's talk about it. Why not? Depending on the jurisdiction where you work in, there are areas and countries which allow more than one specialty to do this kind of procedures. We have seen cases where maxillofacial surgeons have done breast surgery. Dermatologists have done breast surgery. Am I saying it's wrong? I say I don't know. Only thing I'm saying is there are specializations in this world who are trained exactly for that, and these are plastic surgeons. So obviously, being a plastic surgeon, I would say yes, plastic surgeons are the ones to do this. They should be the ones to do this because it's absolute crucial part of their training. No matter what, regardless where you get trained as a plastic surgeon, breast surgery is a big part of it. And you get properly trained in it, so the safety for the patient increases. When it comes to the price, it's very similar. If you have a plastic surgeon like yourself who has gone through decades of training and experience, obviously many problems will not even occur because we can already anticipate them and avoid them. If somebody is just at the beginning of his or her journey, obviously first of all the reputation in the market is still not there. It takes time. So in order to attract patients, the unhealthy reflex is to lower the price. If you lower the price, the aim is to get patients in. Now there are two things I can add to it if I have the time.
Of course, go ahead.
One is that, and that I even tell my patients this analogy. I say, it amazes me that patients sometimes put much more time and effort into comparing cars, car prices, quality, service, maintenance contracts than they do when they choose the surgeon and the implant. Why is that? I think the reason behind it is a very positive one. There is so much trust in the medical profession that patients think if the doctor says it's safe and good, he's a doctor. I should trust and I should go ahead. But the truth is, like anything in life, if you want something really exceptionally good, it comes with a price tag. And another analogy that I would like to add is, there is a story of the consultant that went into a company with big problems and they asked him to solve it. And he looked at the data and the files and after 5 minutes came up with a solution. And then he said, $10,000 please. And they would say, what, are you insane, $10,000 for 5 minutes of work? And he said, you're not paying me for the 5 minutes, you're paying me for the 20 years of experience it took me to solve this in 5 minutes. And this applies to plastic surgeons too.
That's a great analogy, and I totally agree with you, Afschin.
Yeah.
Absolutely correct. Now, there's one more challenge that we are facing these days, and I'm sure you're facing that as well, with massive weight loss. People losing 20 kgs, 30 kgs, 40 kgs of weight. What happens to the breast in women, and what are the solutions for that?
Yes. So the effect of the breast is very variable. It depends if there was a childbirth before, yes or no, and how much of weight was lost. It can go up to 120, 130 kilograms. We have seen it, both of us. It also depends on the so-called quality of tissue. So I have seen cases after 40 kgs where the breast has shrunk, but the envelope was still okay, position of the nipples were okay, so you could basically just do a breast augmentation without any other procedure. But in most of the cases, you're required to do more. So that means augmentation, so means enlargement plus a lift of the soft tissue envelope, because the breasts tend to sag. And when they sag, just putting a big implant will not give you the desired results, because you convert small hanging breasts to big hanging breasts, and that's not what we want. So then comes the question, and there are two different schools. Should I do it in one, or should I do it in 2 stages? I say there is no right or wrong. It depends on the hands and the experience of the surgeons, how they were brought up in their training. Personally, I try to do it in one go. So that means breast augmentation plus lift at the same time. But if a surgeon is more comfortable in first lifting the breast, and after 3 to 6 months, after the tissue is settled, then to do the augmentation, it's not wrong. It's also okay. Still, we need to anticipate, because of the overstretching of the tissue and all the damage that has been done to the tissue because of the weight gain and loss, that especially in these patients, even after 1 or 2 years, small corrections may need to be necessary, like lifting the areolas again a little bit up, or removing some more of excess tissue. These are nips and tucks, small corrections that still may be necessary even in the best hands.
I'm sure you would agree with me, Afschin. Now, when you perform the surgery, you are a surgeon, you are in the operating room, and you have decided, you have planned hours, you've done your homework previous night, all of those things. And when you perform the surgeries, you have seen, you have checked the result. Obviously, you can't make the patient stand. You could just maybe lift the bed up and check, and you feel it's tight enough and all of those things. What happens over a period of 6 months? I'm sure there are times where you come across where you see what you saw in the beginning is not what you see after 6 months.
Yes.
Why do you think so?
It happens because at the end of the day, when you do an augmentation purely, or you do an augmentation plus lift, obviously the tissue is just tightened. So everything is stretched and is firm. But the body has a natural response to tension. And the natural response to tension is to produce more cells to release the tension. I tell my patients, each body has its own tension memory in the cells, and it's scientifically proven. So between the cells there is a link, and this link measures the tension. So if you over tighten a breast because you think the tighter the better, in a particular patient you can tighten as much as you want, even to the point where the breast is not blood supplied anymore because it's too tight. The body will just produce enough new tissue to make it loose again. So first of all, it's a natural response to the body after surgery to produce more cells to reduce the tension. This is anticipated. But in some patients, this happens too much. So there will be a sagginess and there will be a softness, and then obviously small corrections may be necessary, but which can be accomplished.
Thank you very much, Afschin. That was great, to pick up your brain, and thanks for sharing it with our audience. A very strong advice from us is, obviously, when you feel that you need a procedure like breast enlargement, do meet the specialist consultant, do take their opinion seriously. They would not only consider your immediate result, but they would also think about long-term effect on you. And most important thing is to do follow up with your surgeon on a regular basis. Thank you very much, Dr. Afschin. It was great to have your experience and your knowledge, share with our audience. And I'm so glad that you were here today.
Thank you, Dr. Sanjay. It was a great, great pleasure for me being here with you and exchanging ideas. Thank you again.
Thank you very much.